David Pakman Show at davidpakman.com.
Okay, let's talk about the economy today. Donald Trump has been touting the current economy as the best ever. Trump has been bragging about how strong the economy is in general. He says it's the best it's ever been for Black Americans, the best it's ever been for Hispanic Americans. And he usually points to unemployment rates and the stock market being high. And yet at the same time, 40% of the population is still struggling just to pay their basic bills every single month, which is more than 100 million people in this country. How is it possible that we have the best economy ever and 40% of the population is struggling to pay their bills? And to really understand this, you actually have to zoom out because it's bigger than Trump. Of course, when Trump says something like this is the best economy ever, it's meaningless political hyperbole. But there's a deeper analysis to be done here that is beyond left-right politics, or at least it's beyond Donald Trump. So let's do it. It's true that the economic expansion that the U.S. has seen dating back to the beginning of Barack Obama's presidency is on paper the longest economic expansion in the history of the United States of America. That's true as defined as we define expansions. And still, we know that a huge portion of the country can't even afford an unexpected $400 emergency expense. How is it possible that both are true? The stock market is at record highs. The unemployment rate is historically at its lows. And yet there are a record number of people who are 90 days or more behind on car payments, which is a concerning indicator that can predict economic trouble. And that number continues to climb every single month. That's not good. How can there be signals on paper that things are so good, and at the same time, nearly half the country can't pay its bills? And the answer effectively boils down to one word, if we need to boil it down to one word, and that word is inequality. It's a little simplistic, but in a sense, it's all about that one word, inequality. I'll explain. The economic expansion dating back to Obama has been hugely unequal. The gains in the stock market that we've seen dating back to Obama are hugely concentrated in a very small portion of the population that owns the vast majority of the stock. So for a huge number of people, even though on paper the stock market is way, way, way up, it does very little for a huge number of people that don't own any or almost any shares of stock. Wage growth has gone mostly to the upper tier. Net worth growth has gone mostly to the upper tier. Stagnant wages on the lower tier. So again, on paper, you can come up with broad averages that look good or at least look okay. But for a huge portion of the country, cost of living has continued to go up, but their inflation adjusted wages have not. So they can't pay their bills, even though on paper they should be okay. Unemployment is low and the stock market is high, just does very little for a lot of the people living in the United States of America. So when you go all the way back to 1989, 30 years ago, the bottom half of the country is less wealthy today, inflation adjusted, than they were 30 years ago. This is stunning, given the economic growth that in total the United States has seen in the last 30 years. And the explanation is inequality, or specifically unequal growth in almost every aspect of the United States economy. And the problem with this is that the economy is, in a sense, hanging by a thread. Even though so many numbers look good, as Donald Trump talks about, there are like 100 million people in this country for whom even a mild economic setback in the broader economy can push them into a completely unsustainable financial situation. This could include a bankruptcy. This could include having to rack up crushing credit card debt at high interest. This could include a home foreclosure or an eviction from a place that they rent, vehicle repossession. And of course, remember that in the back of our minds is the possibility that a medical bill could bankrupt us completely. Our health insurance system fundamentally weakens the economy. Because of the system that we have, people who are even in an okay financial position are still at risk of losing everything because of unexpected medical bills that may not be covered by their insurance. That's how the system works. That's how the country works, which sheds a lot of light on the reality that our health insurance system is an economic liability beyond just being a moral and ethical liability. So the thing about all of this is that because these things are so political, each president, each party, they always want to take credit for any wins they can take credit for. They want to shirk responsibility for any of the losses that they can successfully shirk responsibility for. That we end up unable to have the real serious conversation as a result. This is actually bigger than Republicans and Democrats. Now, it's true. It's not totally apolitical. It's true that historically, Democrats are better than Republicans in terms of stock market returns, but that doesn't affect everybody equally. It's true that historically Democrats are better than Republicans in terms of the average unemployment rate during their presidency, but that doesn't actually tell us whether people are making a living wage or whether they have to work multiple jobs in order to make ends meet. By the standards we use, Democrats are better than Republicans, but unfortunately those standards fall very, very short. And these are just bigger issues that don't even enter into the political election cycles that we have of 2, 4, and 6 years, 2 years for the House of Representatives, 4 years for the president, and 6 years for the US Senate, respectively. Automation and technological unemployment is one of those issues. Inequality is another one of those issues. Education costs are another issue that around the margins you will hear politicians talk about, but nothing serious has been done to deal with that. The healthcare system, fortunately, it's entering more into the political discussion, particularly since 2010 and Obamacare and Bernie Sanders mainstreaming the idea of Medicare for all in 2016. But this is why you hear the economy is the best ever. And there are actually some numbers that sort of seem to reflect that in some way, but yet almost half the country is hanging by a thread. That's not going to change. Listen, if the stock market, if the Dow goes to 30,000, still a huge portion of the country will be at risk of a $400 unexpected expense, throwing their financial situation into total disrepair. You are not going to change that if the unemployment rate goes from 3.8 to 3.7%. Okay, these are bigger systemic issues. And inequality, if I had to sum it up in one word, tells us a lot about why this is the case. Let me know what you think. I'm on Twitter at @dpacman. The show is on Twitter at David Pakman Show.
The David Pakman Show at davidpakman.com. The David Pakman Show at davidpakman.com.
Okay, today's new members of the day, James Maples and Jonathan Newman. Really appreciate James and Jonathan for becoming members of the David Pakman Show at www.joinpakman.com. Also want to say thanks to a member who's been with us almost 5 years. It's Michelle Isles. I hope I'm pronouncing that correctly. Maybe it's Ailes, Michelle Isles. Michelle, thank you so much for being a David Pakman Show member for almost 5 years. Join James, Jonathan, and Michelle at www.joinpakman.com. Okay, let's get to the phones at 617-830-4750 and see what is on people's minds today. Why don't we start with our caller from the 678 area code? Who's calling today from 678?
Hi, David. This is Joseph.
Hey, Joseph, what's going on?
Hey, crazy that I'm on the show right now. This is cool.
Yeah.
So my question is about the 287G program. Do you know anything about that?
I know nothing about it. What is it?
Okay, well, it's basically a program about partnering between ICE and local sheriffs. And I was just, since you don't know anything about it, this is something that I wanted to ask you.
Oh, is this, so maybe I know about it, but not by that name. Is this the idea that ICE wants local sheriffs to be reporting to them on immigration status of people that they're interacting with?
Yes, exactly.
Okay.
So what happens with the program is ICE basically deputizes the sheriff's department to be ICE officials and act as ICE officials, and they
Right.
get extra funding because of it. So I was just wondering about, is there any way that a state legislator could fight against that in any way with any kind of legislation? I don't know, since it's federal funding, I don't know.
I don't know the legality of it because sheriffs are usually county based. It's unclear to me whether those are decisions that the state could a state outlaw any county making the decision to accept those funds. What happens in terms of the federal supremacy? I genuinely have no idea what the legality of it is. I know that I'm against it, but I wouldn't be able to
Yeah.
say what the legality of a ban at the state level on accepting those funds and partnering in that way would be.
Yeah, that was just my question because I live in Gwinnett County and we actually deport 20% of the immigrants in this small area. So that's just a big issue that I was thinking about. If you could maybe like do a video about it or something, that'd be super awesome. I honestly don't know. I've been researching it myself. I volunteer at the local Gwinnett Democratic Party. So it's just something that I wanted to talk to you about.
Yeah, well, the thing is, Joseph, even if there are funds available, it's still time that your local sheriff's department is spending on something that to you might just not be a valuable use of time. And that is a huge area where people should be activating around. I mean, if you live in a place and you presumably you do have an interest in how the sheriff's department is spending their time, you should have a voice which says, I don't want sheriffs wasting time communicating with ICE about the immigration status of people. I want them focused on whatever it might be. If there's opioid abuse issues going on where you live or whatever else the case may be. So I think that you should be activating around it, and you're doing the right thing by thinking about this stuff.
Yeah, that's really great. Yeah, that's what I'm trying to do. I actually was speaking to a recent candidate that's on the Democratic side for our Gwinnett sheriff, and he was talking about ending the 287G program. Yeah, and I just was trying to think if there's any other way, if I could just try and engage with my state reps or things like that.
I would do it. I mean, listen, even though I don't know what the legal circumstances are, contact them anyway, and they can tell you what it is. Make them work and tell you what it is. All right, Joseph, thank you for the call. I really appreciate it. Important topic, and glad that you brought it up to me. Hope to hear from you again. Let's go next to our caller from the 313 area code. Who's calling today from 313?
Hello?
Hey, that's you.
Okay, yep. Hi, this is Jarrell from Detroit.
Hey, Jarrell.
And how you doing? And I was just wondering what your take would be on using your platform is one of the largest on the and on the internet on the left. I was wondering what your take would be on using it to like get other smaller platforms known. If you get what I'm saying.
Yeah. So, you're using my platform to make other platforms know. You're saying like other content
More
creators
popular.
or other
that's what I meant. Other content, like smaller ones, like most people know Destiny, but like people, a lot of other streamers do a lot of good work battling against horrible right-wing ideas, and I feel like some of them could use more support. And
yeah, sure. Listen, Jarrell, I don't know if you're rubbing a banana on the phone or something, but it sounds very, very odd. I to the extent that I know of people to promote that are doing good work, I'll talk about them. The show mostly is about political issues and topics, so that's what the focus is. But if there are specific people that I think are worthy of a mention, I will certainly talk about them. Okay, I'm going to let you go just because that something is up with that connection. I don't know if there's maybe mice in your phone or something like that. Okay, let's go next to our caller from the 253 area code. Who's calling today from 253?
Hey, David, it's Jim, and I just wanted to say, long-time listener, first-time caller, love you. And I just wanted to talk about the Green New Deal and just see what ideas you had about maybe getting that pushed through. And also, a guy I despise came up on my YouTube the other day on a commercial, Gavin McInnes, on this new show, Free Speech. And I was trying to click out of it right away. And then all of a sudden I saw Dr. Cornel West and Mark Lamont Hill on the show.
Yeah.
And I actually checked it out, and it's a cool show in regards to just liberals nailing Gavin, and it was so awesome to watch, especially Mark Lamont Hill. I canceled my subscription because I saw all the shows, but I just thought it'd be awesome if you could get on his show and destroy him for us.
So hold
please.
on, you canceled your subscription to what?
Oh, I signed up just to watch the Dr. Lamont Hill.
I see.
And Cornel West show on the Free Speech.
I will have something to say personally that I'm involved with that affects me with regard to this new Gavin McInnes show at some point soon. Like I can't talk about it yet, but I'm gonna have something to talk about related to it because I've had like a personal run-in with this program, and I think it'll be an interesting story. As far as the Green New Deal, listen, the Green New Deal is a broad framework. So when you say pushing it through, I mean, listen, right now it's not going anywhere. Republicans control the Senate. I think that there's lots of good ideas in the Green New Deal. We interviewed one of the architects of the Green New Deal on the program a couple of months ago, I guess it was. But as it is, even if it passed, it's really just some general ideas and principles without a clear roadmap of how to do it and how to fund it. So I support a lot of what's in it, but hopefully after the 2020 election, Democrats will be able to actually start making some headway on the components of it.
I agree, my friend. God bless you. You're the best. Keep fighting, and we love you, brother.
All right, Jim, thank you. Appreciate the phone call. Thank you very much. Hope to hear from you again. Let's see. Let's go next to, why don't we go to our caller from the 203 area code? Who's calling today from 203?
Hey, David, is this me?
Yes, that's you.
Hi. So I'm curious about your take about the Supreme Court. I know recently Bernie Sanders came out and said that he's against increasing the number of judges in the Supreme Court.
Yep.
But he's pro like a circuit of like judges coming through. What's your take on that? Do you have any opinions on that?
I've seen some convincing arguments about stacking the court, packing the court, and increasing the number of justices. I do also think that it's one of those things where if we do it, then it's opening up the door for them to do it. And the reality is that right now, the left has much more to lose from not changing the structure of the Supreme Court, because Donald Trump, partially thanks to Mitch McConnell's obstruction of Merrick Garland, has already had 2 Supreme Court picks, and there is potentially going to be a very conservative Supreme Court for a long time. So I understand the appeal, although I worry about opening up that door. In terms of the idea of Supreme Court justices not serving for life, I find that very interesting as well. The only problem is, like with all of these things, once you know you are not going to be serving for life, you potentially could be influenced in terms of how you decide cases based on whether maybe there is a party to one of those cases that after you are no longer on the court, you might consult for or work for or whatever. And it creates a lot of complicated issues related to conflicts of interest and recusal. So I like a lot of these ideas, and I also recognize some of the shortfalls of them.
Yeah, I've seen some proposed bills of like, judges and both congressmen and the Senate to like not get into those industries after they leave office. But
no, that's the thing. If you limit with Supreme Court justices, if you say you no longer have a lifetime appointment, but you also have to agree not to work for any of the industries whose cases you hear while you're on the court, it becomes almost impossible, right? Like, what are they expected to do, because the Supreme Court hears so many different cases? So I don't know what the solution is, but I think that there's definitely improvements to be made.
All right. Thank you, David.
Okay. Appreciate the phone call. Thank you very much. Okay. Let's see who's next here. Let's go to the 774 area code. Who's calling? 774 could be a local viewer. You never know. Who's calling in from 774 today?
Hey, David. This is Cliff. I'm from Worcester.
Hey, Cliff. What's going on?
Hey, nothing. How are you?
Good.
So I was just wondering, I've been watching a lot of Andrew Yang.
Yep.
And so I was just wondering, what's your take? Do you think that socialism makes people more sociable?
I think that's a very, very silly question.
Well, I'm just wondering, just because in general, you got all the money out there, and then more people, they can talk, they can exchange.
Uh-huh. Does socialism make people more social? That's the question.
Yes.
And what does that have to do with Andrew Yang?
Well, he's always accused of being a socialist, but
really, who accused Yang of being a socialist? I've seen him be accused of being a libertarian.
Yeah, I mean, yeah, people, not to say uneducated people, but people just their first assumption of him is generally, he's always attacked as a socialist.
I've not seen that once. Like, who's an example of a person who did that?
Oh, you haven't? All right. Well, I mean, when he was I think it was Fox News. I don't remember the exact name of the anchor, but I know one of them said, and I know he directly said, he said, "Come on, you're smarter than that. You know that this isn't socialism."
Oh, okay. Yeah, maybe that was like Stuart Varney or Neil Cavuto or something like that when Yang talked about UBI. Listen, I
Yeah,
think that
exactly.
absolutely socialism makes people much more social, and it would just improve everybody's dating and personal lives and friendships. I think that's a really, really insightful question.
Okay, thank you very
All
much.
right. Very, very good. Thank you. Okay, let's go to our next caller from the let's go to our caller from the I don't know. How about the 443 area code? Who's calling today from 443?
My name is Rome from
Hey.
Baltimore.
Hey, how's it going, Rome?
I'm doing good. I've been listening to Elizabeth Warren a lot lately and loving her, proposals for 2020. However,
Sorry,
I'm curious to see what
I'm sorry. Your phone just cut out when you. Whose proposals do you like for 2020?
Elizabeth Warren.
Oh, Warren. Okay, yeah, go ahead.
Yeah. So I'm curious to, the proposals are awesome and everything, but we can't do anything without, the Senate. And
Right.
I've not heard anything plans about retaking the Senate. So I'm curious to hear what you think about, I know it's difficult in terms of the roadmap of retaking the Senate, but what are these candidates saying about possibly taking the Senate and retaking the Senate?
I don't see any
Making
path
people
for
more-
Democrats to take the Senate in 2020. So here's how I'm thinking about this, Rome. 2020 for the Senate needs to be. Here's what 2020 needs to be. Expand the majority in the House. Take the White House back from Donald Trump, and at least try not to lose more than a seat in the Senate. Because if you look at the map for 2020, it's tough. You also have Doug Jones, a Democrat in Alabama, who won barely against a serially accused child sex assaulter in Roy Moore in the special election in 2017. He's trying to defend a seat in the very red state of Alabama. So I think that we just need to manage expectations. I don't see any path for Democrats to take the Senate in 2020 that is going to limit what Democrats are able to get passed, even if they do take the White House in November of 2020. But I think of 2020 like as a setup year to then in 2022 hopefully be able to take control back of the Senate. But I think the reason you don't hear a lot of Democrats talking about taking the Senate in 2020 is because most of them know it's just not going to happen.
So here's my follow-up question then. Wouldn't the question about who has the best policies be null and void if you're not able to get anything passed?
No. You can listen.
Question.
Just because you're not going to pass Medicare for all between January of 2021 and January of 2023, which would be like that 2-year period, doesn't mean that we don't still want to vote for the person who has the right proposal. And you never know what they might be able to negotiate with Republicans in the Senate and a House that Democrats control. And then you've got the 2022 election. So it's not null and void. I mean, listen, if you say to me, there's a 5% chance Medicare for all gets passed, no matter who is in the White House, merely because Democrats aren't going to control the Senate, I still want the person that I agree with on Medicare for all in the White House. It's not null and void at all. It's just, it might be part of a 4 or 6 year process that starts in 2020.
Right. So my intention with what I said really was to try to focus more on the 2020 question in terms of what would be the most important thing for Democrats. Are we looking at electability and beating Trump, or are we looking at who has the best policies with regards to what can be passed for Democrats?
I don't even think we need to think of it that way. Right now, we have a primary. We've seen from the polling that we've seen, all of the top 4 or 5 candidates right now will have a shot at beating Trump, and it's going to come down to turnout. So right now, we just want to hear from the candidates. What are their policies? What are their positions? Let's pick the people that we agree with. Once we have a general election candidate, then we'll get to trying to beat Trump, which I believe we can do on turnout. We actually, the differences in terms of the specific candidates and how they're polling against Trump, there are differences, but ultimately this could well be a turnout election. So I would not think about it. I would not now just start thinking about electability.
Right. Gotcha. Well, I appreciate the work that you're doing. I will keep doing good work up on it.
All right, Rome, thank you. Please let's see if next time we can get a better connection, because I love what you're saying, but I just am having a hard time hearing a lot of it. And that's never good for anybody. Okay, let's go next to our caller from the 214 area code. Who's calling today from 214?
Hello?
Yeah, that's you.
Oh, hi.
Hi, who's this?
My name is Melissa.
Hey, Melissa, what's on your mind today?
Recently, my mom, who works in a restaurant, was robbed at gunpoint.
Oh my goodness.
It was in, the person was unmasked, and the person came in broad daylight. I think they had someone come in and just like scout the place to see if there was a low in customers, which there was at that time.
Mm-hmm.
And so she was robbed at gunpoint. So I almost lost my mom to gun violence, which is something that happens a lot. And I don't really hear any of the candidates talking about gun control. So I wanted to know, I don't know, I feel like, especially where I'm from, there is a lot of pushback whenever we talk about gun control.
So where is it
So I
that
just
this
wanted
happened,
your-
Melissa? What part of the country?
Texas.
Texas. Okay. So
Yeah,
here's
I mean, there's-
here's the unfortunate sort of reality on the gun issue. It appears, from the more we learn about this, it appears that there is very little upside for Democrats, particularly in the primary, to get into disagreements or even debate the issue of gun control, because there doesn't seem to be significant electoral upside to doing it, particularly not at this point in time. As a general thing, it's not clear how many people in this country in national elections are voting on the basis of the gun issue. And I think that there's just a reality that right now there's very little incentive for the Democratic candidates to start arguing with each other very much on the issue of guns. You saw some disagreements actually during the debate when the topic of guns came up. But I just think structurally there's not an advantage to Democrats delving into it too much now. You'll probably see it more in the general election.
Okay. Yeah, my thing is, though, people always say, like, one of the main defenses is if we outlaw guns, only outlaws will have guns. So, I mean, how do we convince people? I think, like they say, bad guys will always have guns, but is that true? If we do
No, it's
something
not.
with the
I mean,
guns?
if you look at lots of other countries, you see that's not the case. And the thing is, it's very easy to say, if we change nothing other than putting a bunch of guns on a now illegal list, then people who follow the law won't have those guns and people who break the law will have those. Yeah, obviously, but that's just a very cartoonish and simplistic way of thinking about it. We're talking about much broader changes that relate to the accessibility of these guns, the number of these guns that are even in circulation or available at all. Again, most guns that eventually fall into the hands of someone who obtains the gun illegally or is going to commit a crime with it, at some point that gun was legally manufactured and there was some kind of legal initial entry into the system. So it's too simplistic of an argument to say if you outlaw guns, only outlaws will have guns. It's not even really like a serious argument that's made.
I know. And so I just think, like, now my mom is very fearful to go to work. And part of me is like, how can, we're supposed to be a really great country, this is land of the free, but if she doesn't even have the freedom to feel like she never knows who's going to walk in now and have a gun, and it's like, how can we justify this?
Is she thinking about getting a gun?
I don't know. I mean, I don't know if an employer would allow her to carry a gun. I don't know how. I'm not too familiar with gun laws, but I've never really been interested in guns. So I don't know anything. Yeah.
Melissa, I mean, it's an intractable problem, and I'm really sorry about what happened, but I appreciate you calling in and telling me about it.
Okay, thank you.
All right, take care. Okay, that does it for calls today. Sorry to everybody that I didn't get to. We'll take calls again, and I look forward to hearing from more folks.
The David Pakman Show at davidpakman.com. Welcome back to the David Pakman Show.
All right, for this week's classic interview, the topic of Medicare for all, or some system that would get care to everybody, regardless of ability to pay, was popularized. It was really sort of mainstreamed by Bernie Sanders in 2016. Many of the 2020 Democratic candidates are now talking about this. And we did an interview with a really knowledgeable expert on the issue back in 2012. Okay, this is how far ahead of this thing we were. And 2012 isn't even early. All right, but from the point of view of a show doing this stuff in depth, we were doing this 2012 and earlier. And in 2012, I interviewed Dr. Carol Paris. And that's the topic, and particularly relevant today. Note the language that was used in the interview with Carol Paris compared to the language that we're using now. Different language, but still talking about very similar ideas. Let's get right to it. Dr. Carol Paris is joining us. She's a psychiatrist in private practice in Maryland, also a member of Physicians for a National Health Program. Dr. Paris, it's great to talk to you. I think a good place to start will be to get your sense of why you think a single-payer national health care program would be a better thing than we have now. But also, I'd be curious to hear why some of your other colleagues, other doctors, aren't unanimous in that idea, if it is beneficial, as I believe you think it is.
Well, thank you for having me on the show. Yes, I do think that it is beneficial, and there's lots of statistics we can talk about or not to support why it is beneficial, both for physicians and, most importantly, for 95% of the Americans in terms of just economically advantageous to them, not to mention giving them comprehensive coverage. But why do so I think it's beneficial both from an economic standpoint and from a moral, ethical, healthcare is a human right perspective. But even if you don't approach it from that perspective, just from an economic standpoint, it is superior. Why do I think other physicians aren't on board with it? Well, actually, 59% of physicians that were surveyed back in 2008, and remember, that's even before the Affordable Care Act, 2009 legislation, said that they thought that a national health program would be superior, and that was up 10% from 5 years earlier. That was published in the Annals of Internal Medicine. And just if you look at the numbers of membership in Physicians for a National Health Program, our membership increased by 3,000 or 4,000 physicians in 2009, simply because there was so much more awareness of the problems with our healthcare system, even though there was not a great deal of public media awareness of single payer as an option.
So let's talk about that a little bit. I mean, I think on this program we talk a lot from the patient point of view, why a single payer system would be better. But as a practicing physician, I'm curious what your thoughts would be about how would that allow you to provide better care, or would it affect how would it affect the income of the average physician? I mean, go into that a little bit.
Oh, I'd be glad to. I got into this, as I said, I joined PNHP in 2009, and that was after I had spent 4 or 5 years with our the Maryland State Medical Society. And I was very active in the State Medical Society, and I was quite proud of a piece of legislation that was instrumental in getting passed, that was designed to get the insurance companies on one particular issue to play fair. And when it was all said and done, when the regulations were written, they were written by the insurance companies, and there's no fine for violating the law. And it was at that point that I just said, there is just something wrong with insurance companies. No matter what we do, they will find a workaround. They will find a way to get around any legislation that you pass. And that's when I got involved in Physicians for a National Health Program and started looking at putting a dollar sign on what that would mean for me in my own practice. And one of the things that I came across was an article in Health Affairs that suggests that the average primary care physician, the cost to the average primary care physician is $68,000, somewhere around $68,000 a year per physician per year, just as the cost of dealing with multiple insurance companies.
Okay, so this takes into consideration, if I understand, the average primary care physician. I don't know what numbers you're using. Is it a slate of about 2,500 patients that they have kind of on their roster?
I don't know what the number of patients is. This was published in Health Affairs.
Okay, but the idea would be that the average physician with an average patient load, because of both billing and timing put into working with insurance companies, would stand to save $68,000 if that bureaucracy was eliminated.
That is correct.
Okay, now as far as care is concerned, does it just follow that simply by not having to deal with that, you're providing better care? Well, I think usually you have people working on the billing side, so I don't know that that's the argument, but how would it translate to better care?
Well, actually, the people that I have working on the billing side are medical assistants. They could actually be doing blood pressures and weights and actual things that would be good for my patients, rather than answering phones and chasing prior authorizations. So from that perspective, it would be good for the patients. Plus, if I'm getting a raise simply by not having to have so much overhead go into dealing with multiple insurance companies, then I might actually be able to see a couple fewer patients a day and spend more time with the patients that I'm actually seeing, which definitely translates into better care. I think if you ask the average patient what their feeling is about the amount of time that their physician spends with them, I don't think you're often going to hear that patients feel like their doctor spends as much time as he or she need, or at least from the patient's perspective, that the patient feels is necessary. And I don't think that's because doctors don't like to spend time with patients. It's because we're like hamsters in a cage. Unless we see a volume of patients every day, we can't pay the bills. We can't pay our staff and have any money left over for an income.
So on the last end of this, I guess my question would be about as far as, and this is probably an issue that has multiple influences, both the fear of lawsuits, but also what insurance companies will and won't cover, which is that of necessary or unnecessary tests that are often done. We just did a piece a couple of weeks ago about a number, I think it's 45 different tests that a group of doctors came together and said, these are really overdone, and if people did them less, in more specific conditions, we would actually eliminate a ton of spending. At the same time, a lot of the reason that those tests are being done is because doctors both need to cover themselves and know that if they're not done and documented, future procedures may not be covered. So talk a little bit about how the diagnoses and testing might change with a single-payer healthcare system.
Well, the argument is made that doctors do so much of the testing because they're afraid of being sued.
Right.
Right? And so when you think about malpractice, and you look at when you break a malpractice award down, the majority of the money in any malpractice award is to cover the patient for future medical care. Mm. Well, guess what? That goes away if we had a national health program, because that's already assured. You get your Medicare card the day you're born and you lose it the day you die. So necessarily, every malpractice award is going to be significantly reduced if we had a national health program, which then translates into a smaller premium for your malpractice insurance because the payouts are not what they used to be, which again translates into more income for doctors and fewer malpractice claims, because the majority of the reason that people pursue a malpractice claim in the first place is because they need to be assured of continued care. And if they don't have to be assured of continued care, then if it's one of those cases where it really wasn't malpractice, but it's equivocal and the patient's is going to have expensive care for the rest of their lives, that goes away with a national health program.
Okay, I wish we had more time. We've been speaking with Dr. Carol Paris. She's a psychiatrist in private practice in Maryland, also a member of Physicians for a National Health Program. Really great to speak to you, and we'd love to have you back again.
Thank you very much.
The David Pakman Show at davidpakman.com. The David Pakman Show at davidpakman.com.
All right, audience questions. I'm finding that I'm getting better at picking some of these lately. I'm having a better sense of what is the audience actually interested in. We had a lot of duds early on. Okay, the question, of my fault, of course, not anybody else's. Poor selection. The first question today: could Trump voters be convinced to vote for someone like Bernie or Warren if Bernie or Warren were the nominees? There's always like 2, if not 3 answers to these "is it possible" question. The first is, of course it's possible. Some Democrats voted for Trump. So in a sort of general abstract sense, yes, there are Trump voters who would be convincible to vote for Bernie or Warren. And many of them would just do it without needing to be convinced, merely because they're not pleased with Donald Trump, some fraction of them. Now, what is the real philosophy that would be the most cleanly transitional one from being a Trump voter in 2016 to a Bernie or Warren voter in 2020? I think that it is populism. Now, it's really important. I have no confusion that the populistic rhetoric of Donald Trump is, number one, bogus, but number two, it's a right-wing rhetoric. It's a more nationalist rhetoric, nationalist populist rhetoric. It is not at all the same thing as the left progressive rhetoric, certainly of Bernie Sanders and to some degree of Elizabeth Warren. But the messaging, at least at the superficial level, can seem quite similar between Trump's faux right populism and Bernie and Warren's actual left populism. So there is no doubt that if you were attracted to Trump in 2016 on the basis of his populistic-ish, I mean, I'm hedging, it's not populist, it's populistic-ish sort of rhetoric, then there is actually a sort of credible path to get over to somebody like Bernie Sanders and Elizabeth Warren. And in fact, anecdotally, we heard about Bernie primary supporters who ended up voting for Trump, which I was a Bernie primary supporter in 16. I think it would have been absolutely whacked to support Trump. And here we are, Trump having 2 Supreme Court picks and almost going to war with like 3 countries, which Hillary simply would not have done. Not that I was a Hillary lover by any means. The problem with like a big picture move from Trump voters to Bernie or Warren on policy and philosophy, rather than merely on they're displeased with Trump and maybe they'll vote for the alternative, is that there is no real coalition within the American right that fits into the Bernie Warren thing. The right populist rhetoric of 2016 may work to get some people just by sort of a numbers game to support Bernie or Warren. But it's not like the evangelical right that ultimately went for Trump, even though early they liked Cruz and whoever else. That's not a coalition that's going to get behind Bernie or Warren, even though I would make the argument that Bernie and Warren's policy is much more in line with what evangelical Christianity at least claims to stand for, if not actually stands for. The pro-gun coalition that ultimately got behind Trump because he said some stuff about liking guns or whatever, they're not going to get behind Bernie or Warren. So I think that's the issue. And then the most important thing to point out is I don't think it's good strategy to try to win 2020 by convincing Trump voters from 2016 to vote for Bernie or Warren or whoever the Democratic nominee is. We saw earlier this week that Emma Vigeland clip from earlier this week where Emma interviewed just maybe the dumbest Trump supporter we've ever seen, who said she wouldn't vote for Joe Biden because of something related to white/black, referring to race, and Biden's a socialist because he's all about the money and is a billionaire. None of that's true, but this is what the woman said. It was made abundantly clear that what I've been saying for a year or more at this point is right. As a strategy for winning elections, don't try to convince Trumpists to vote for someone else. Just get the half of the people on the left who didn't vote last time to vote. You don't have to convince them of anything other than just to go out and vote. That's much easier than completely upending the beliefs, as harebrained and fact-free as they may be, of a lot of these Trumpists. Okay, a lot of reaction to my appearance still now a month ago on the Joe Rogan Experience out in Los Angeles. And I got a few different versions of this next question, which generally speaking here's one example of how the question was asked. David, now that you've appeared on the Joe Rogan program, can we reasonably believe that you are an official member of the intellectual dark web, where theoretically do you now fit on the alt-right network map, if just for some giggles? Yeah, I don't think I'm anywhere on the alt. I'm the only alt-right map I'm on is the map of targets, right? That's the only one. I don't know. Listen, I don't know who's in or out of the intellectual dark web. I don't profess to be in or out. I just don't have really any clue what the boundaries are of the intellectual dark web. What is very interesting, though, is that since the Rogan appearance, a lot of my content that is posted on mostly left-wing subreddits has also been appearing on the intellectual dark web subreddit, on the Sam Harris subreddit, etc. And it is very interesting that on the one hand, you have what's called the BreadTuber Coalition, BreadTube. There's a prominent subreddit, which is definitively lefty content. It's exclusively lefty content. And then on the other hand, you have the intellectual dark web, which is pro-free speech, center-left to right-wing content. There's a variety of views represented within the intellectual dark web online enclaves. And some of my same pieces of content are being posted to the BreadTube affiliated subreddits and to the IDW affiliated subreddits, which is interesting. And maybe, I mean, listen, sometimes I get criticized for being boring because I see both sides of a lot of issues. When there aren't two reasonable sides, I don't see both sides. Like the abortion debate. I don't find any value in the abortion is murder and it should be a legal thing. Like that, I just don't even know how to integrate that into my perspective on what abortion law should be, and that'll actually be the topic of the next audience question. But on a lot of these issues, nuance is required. Identity politics. Toxic identity politics, where one's identity is used as a cudgel or as a knife or as a mallet to beat people over the head with, is bad. It's not the biggest issue, but it's bad and I call it out. I also recognize that to ignore the reality that people's identity as representative of who they are may bring them unique perspectives on political issues that should be listened to. It's just like the most minute amount of nuance. And apparently in some circles that qualifies it both as a BreadTube perspective and as an IDW perspective. I don't know, but certainly I've received no official or unofficial invitation to the intellectual dark web. Although there were actually some tweets floating around last week about maybe me appearing on Brett Weinstein's new podcast. I don't know, never remember. Weinstein, I believe, his new podcast to talk about what's going on with YouTube demonetization. And I'll appear anywhere to talk about that issue. I think it's an important issue that should be discussed. Okay, I sort of alluded to this next question. The third audience question today is, David, does a middle ground on abortion exist? I heard you mention on the Joe Rogan program that you can't include any crazy idea in the discussion, but is there a middle ground on the issue of abortion? There is a middle ground on the issue of abortion only when you've narrowed the conversation in a pretty significant way. And what I mean by that is, if your position is abortion is murder and it should be illegal, I don't know how you find a middle ground with that person that has any kind of legal abortion. I mean, the fundamentals of how different political factions see abortion as an issue, unfortunately, prevent productive dialogue in a lot of ways. My view is that this shouldn't even be a discussion. There are lots of legal medical procedures that, if we see a video of, may be repelling in some way. This for me includes, I don't want to watch a heart bypass. I don't think it should be illegal. Doesn't mean I want to watch abortions, but that doesn't mean those should be illegal. However, if you are brought to the table with someone who says any abortion is murder because, one day after conception, that is a person, I don't know how you actually find a middle ground there. Now, I do think that what's really different about abortion than many other issues is the outcome that the left and right at least claim to want, and I believe do want, is actually the same. The left and right both don't want abortions. So when you talk to the right, they don't want abortion to be legal or accessible because they believe that it is murder. When you talk to people on the left, they don't want abortions to be necessary, and they want to reduce the number with sex education and contraceptives and so on and so forth, but they do believe that abortion should be legal and safe. That's why it's been so interesting to see the resistance from the right to say, hey, you know what? The left actually does share the goal of reducing the number of abortions. Empirical studies tell us how to do it, and it's with safe and legal, safe and full and inexpensive access to birth control, as well as comprehensive sex education. They don't want that. And a lot of this relates to what George Lakoff describes as strict father morality, where it doesn't fit into the moral framework of many on the right that you would be able to have recreational, non-procreative sex outside of a marriage and have a tool that prevents pregnancy. There's too many people on the right who, for moral reasons, believe that sex should be, to different degrees, between married heterosexual couples for the purposes of procreation. And if you do choose to have sex outside of marriage, then you don't deserve, it's not right morally to have a way to prevent a pregnancy, because that would be chaos. And we know sort of all of the other beliefs that come with that. So the last thing I'll say on this is the right has very successfully actually managed the issue of abortion, despite the fact that over time, the average position in the United States on abortion has moved towards, I believe it should be legal in most cases. More than half of the country now believes that. When the right continues to have these extreme positions sprinkled in, at least, any abortion should be illegal. These marches for life, right to life marches, where it gets completely wacky. I mean, really, really wacky speeches and crazy, crazy stuff. They pull the Overton window to the right, and they benefit from this. That's the reality. It puts the pro-choice contingent on having to defend even abortion being legal, rather than getting to the real issues of providing contraception to people, sex education, etc. So unfortunately, the right has succeeded, partially because they have used extreme positions to pull the debate to the right, partially because their framing is really simple. Abortion is murder and we shouldn't do it. Whereas the position on the left is not abortions all the time, no matter what. It's, yes, we would like to reduce abortions, but you have to take into consideration all of these other factors, et cetera, et cetera. And George Lakoff has written a lot about that as well. Send me your thoughts. Is there something that we could call a middle ground on abortion when one side of the debate believes that any abortion is murder, they should all be against the law, and all sorts of different people should be punished, whether it's the doctors, the mothers, or whoever else? Let me know what you think. We've got a great bonus show coming up for you today. Become a member or a patron to get instant access to the bonus show. Otherwise, I will be back with you with a new show on Monday.
The David Pakman Show at davidpakman.com.